Hey everybody, I hope you're doing good. I got a new camera, but I haven't figured out yet how to tape on it or record on it. I mean, I know how, it's just that there's a problem with the sound, and I have yet to figure that out. And tonight, I'm not really going to do a long video because the depression is high. It started yesterday and went from medium to high to now it's at fuck this. Um, Not gonna lie. Tomorrow will be my 8-year-old son's anniversary, if that's what you want to call it, of his death of 24 years. And although it's 24 years, it doesn't make it any better. So I just don't feel like talking. I don't feel like just talking. I don't know what to talk about. I watch TV and I cry, and I just am gonna isolate. I don't know. I woke up at 5 o'clock and I'm like, holy cow, I slept a long time, thinking it's 5 o'clock in the morning. Good, I can get up and go to the bathroom and go back to bed. Come to find out, it's 5 p.m. on Wednesday. The last time I remember seeing the light of day was Tuesday, when I was watching some videos about how to fix the humming and noise that my camera's making, my new camera is making when I record. So that's the last thing I remember. I woke up eating pizza, or attempting to eat pizza, and some of it was on the floor, and it was crappy anyway. But all of a sudden, I picked up a piece off the floor after stepping on it, and then David let the dogs in. Also, the dogs have a piece of the pizza, and I'm like, what's going on? This was last night or the night before. I don't even know what day it is. I don't know what has gone on. No idea. But the only good thing is I did get some sleep. And, when I talked to him, he's like, yeah, that was yesterday. That wasn't today. When I'm like, yeah, it was. He's like, today's Wednesday. I'm like, wow. Because I know I was up for like 2 days straight. And I tell my therapist that because I saw him on Tuesday. And I said, how are you supposed to get me off these benzos, off the Xanax, if I never get to see my psychiatrist? I see her every 3 months. Well, she's busy and all this. And I said, well, she's never going to get me off this unless she knows how I'm doing. And she has me on 2 benzos. He goes, well, that's what I'm here for. It's like, oh, fantastic. And David tells his therapist and his psychiatrist about everything that's going on. They want me to jump ship. They want me to go see them because they feel like I'm not getting the care that I should be. And I got a voicemail of a recovery center trying to get me to come and stay for 90 days. I've got, uh, like not scam, but offers for an extended warranty, on my 25-year-old car, but to want to commit me or have me committed, because they left me a voicemail, which it the text gets put into words where I can read it. Thank God, because then I showed my therapist and all that, and I'm just like, really? Now they're spamming you, trying to get you to be committed? Plus, they're going to find out if there was a HIPAA violation, because there were things in there that were about me and my conditions and things like that that shouldn't have been in there. So there may have been a HIPAA leak, and I'm going after them for that. Not as in like a lawyer, but find out where there possibly have been a leak. A HIPAA leak, because that's not cool to have that information in somebody's hands. Why else would they? And my therapist, I'm ready to leave him because he's like, oh, this happened, bipolar's been, well, I said I know bipolar's been around for a long time because I've had it. But borderline personality, that's something that's new to me, only a few years, not a long time. And that was the first one that this phone call mentioned was borderline. And it's like, I hardly even know what that is. And they mentioned that, and bipolar, as well as substance abuse and things like that. And my therapist keeps blowing it off. Well, that's mostly for you know abuse of drug abuse and things like that, substance abuse, not so much mental abuse. But sometimes, yeah, they go into it. Why are you fucking defending them? Don't you understand how upset I am? Well, it's really, they're just talking about, yeah, at the end they were talking about money, great value, a lot of money. And I have insurance, so I'm not worried about that. But, that was more of his thing was, that's why I think it's just, a scam and this and that. Well, I've never got a phone scam for my mental health, so there's something going on here and I don't like it. And I did research and they said I should report it to Health and Human Services. And of course where I go, she's like the coordinator. She's like, "Oh no, 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 don't do that. Not yet, not yet." Oh, so you're going to try to cover it up. That's what you're going to do. You got to talk to some people and then you're going to try to cover it up. Cuz it how else would it not be a leak? She knew specific information about me and my conditions and things like that. So I don't know. I don't know if I'm gonna stay there or not. We'll see what happens. See, and now with the holidays coming up, I don't want to deal with this shit. I just don't want to deal with it. And then I guess the trust issue. I'm supposed to trust you. It probably was it a leak? I don't know. And my therapist, he's like, "What if you never find out? What if you never know what happened?" Well, then I guess it is what it is. But I, what if it was you? That's what I told him. What if it was you? What would you do? And it's like, he wanted to sweep it under the rug where I wanted to have a parade, figuratively, where, this is possibly what happened. You need to find out what happened. Somebody needs to have some answers. Somebody needs to give me some answers. But nobody wants to give me answers, and that's what's scaring me the most, is there's a possibility that there was a HIPAA leak, but nobody wants to dive in and find out if there was. They don't just call you out of the blue. It's like if I was, 16 years old and uh, nobody, I would hope, nobody just calls me out of the blue and says, "Hey, you want to have a colonoscopy?" Or 20, whatever. To me, you just don't get phone calls out of the blue for no reason. It's like, just is too suspect for me. And I'm not one to just say, "Oh, okay, it was just a fluke." He's like, my therapist, "I dial wrong numbers all the time." Offering people to get committed? I don't think so. He's just really not taking it very seriously, and it's pissing me off. I don't need this. Not this time of the year, especially. It's like the worst time of the year that this could happen. Um, it's like my PTSD and the depression and all this. It's just not a good time. No time, I guess, would be a good time for, being offered to be committed for 90 days at $45,000 if you don't have insurance, which I do. But he's just, you know, yeah, because they talked about money. Um, I just think it's a scam. They're just trying to get money, and it's just like that's neither here nor there. That's beside the point. What about everything before that? Are you not thinking of that? So I'm not worried or scared anymore. And then when the coordinator called me back, she's like, well, we know this, that, and the other thing. And the person who called and left the voicemail, she left her name, she left where she was calling from, this recovery center, but no phone number. I think she just ran out of time because it was a long ass voicemail. So me, it's simple. You just look it up on Google. So I called him, and a guy answered the phone, and I talked to him a little bit and told him what was going on. And I said, "You mean if she called?" Okay, so first I couldn't talk to the girl who called because she was already gone. Then it was, well, there's no way for him to find her because there's 80 people that work there. And then it was, well, do you want her voicemail? And I'm like, oh, sure. I'll do that. I was freaking out. So then he's like, well, I can't have her call you back. I said, can't you look me up in the system or by my name, by my phone number? And he's like, well, I'll have her call you. And I can't have her call you unless I have your name and number. And I said, well, you didn't ask for it. I said, well, I don't have your name. I said, I know. You didn't ask for it. Well, no. He was just a dick. And I'm just like, whatever. It was Sunday. So, they called it 3:15 on a Sunday afternoon. Kind of weird. But a place like that is open 24/7. You gotta remember that. So, in the voicemail, she wanted me there Monday morning at 10 to 6 in the morning. And he's suggesting I call her during business hours on Monday. That's funny because if I were to take them up on their offer, I would be there, at 10 to 6. Who the fuck? But I'm not letting it go. Not yet. Somebody knows something. She got my number. You don't just randomly call somebody and you want to be committed to some recovery program for alcohol and for mental issues. You don't just get a random call like that. I don't care what my therapist says. You just don't. Like I said, for your car or for tires or for, but that's like getting a phone call, a random phone call for an offer to have an abortion if you're pregnant. Yeah, no, I don't think so. So that's why I'm not buying it. There was a leak. Somebody got my information. They ran with it. And now here I sit. But I'm not sitting down waiting. I'm all over this. I haven't called my own doctor. Well, the receptionist, she's like, well, she wouldn't know. Well, if she knows that I have mental problems and this and that, that's a different hospital, different doctor. If she knows my information, that could be leaked from there. It could be leaked from where we moved from. So, I'm not gonna back down quite yet. Somebody knows something happened somewhere, and, my therapist is trying to sweep it under the rug, and that's pissing me off more than anything, because he's not willing to help me find out the information that I need. So anyway, I don't know if I'm going to do a video tomorrow. I'll see how I feel. But I'll probably be up all night because I woke up at 5 this afternoon not knowing it. Woke up and I'm like, oh my gosh, good. It's 5 in the morning. I got some sleep. and my phone, the numbers are really small. So I didn't want to grab my glasses and look it up. I just thought it was 5 in the morning. No. But the good thing is I got some sleep. I'm probably gonna publish this, and then I'm gonna play with my camera and see if I can figure out the buzzing. You think with YouTube and Google we could figure it out. I remember something came up on the screen, but I didn't know what it said. Of course, I just okayed it. Now maybe if I can do a hard reset. I think I'm gonna look into doing that and see if I can do that. So I hope you have a good night. Maybe I'll see you tomorrow night. Maybe I won't. If not, I hope you understand. So take care.